everyone, welcome to Medic Talks with Health and More. I am Dr. Rebecca Okolo, and today on Medic Talks, I'll be talking with Dr. Dara Okeke, and our topic is medic mortality from diseases acquired at work. This is a very important topic because in Nigeria and all over the world, we've lost a lot of medics to diseases that we can easily prevent. So together, we're going to talk about how to find a way forward, and we hope many medics join us today so we can all leave our opinion and learn a thing or two. So I'm going to add Dr. Dara to the video now. I would like to say please to everyone watching, please leave a comment when we ask the questions. Let's know what you think too. Hello, Dr. Dara.
Hi, good afternoon.
Hi, it's really nice to have you with us.
Sorry, I can't hear you.
Oh, I said it's really nice to have you here with us.
Oh, same here. Like I always watch the show, right? So I'm glad that I'm one of the people anchoring today. So.
Oh, thank you. So, Dr. Dara, before we proceed, can you tell us a little bit about you?
Okay, so my name is Dr. Dara Okeke. I studied medicine in Ukraine for 6 years. Then I go back to Nigeria and I did my internship and everything. Then along the line, before I did my internship, I went to do like a program in public health. So I have public health background. And right now I work in St. George's University. I'm like a clinical tutor in Grenada.
Okay, that's really nice. So Dr. Dara, you worked in Nigeria, you did your internship in Nigeria. So when you were at work, did you ever have any close call with anybody?
Well, I'll tell you, like during the Ebola time, because I worked in a hospital in Ikoyi, right? I really want to say the name of the hospital, but I guess you know the name of the hospital. I don't know if I should say the name of the hospital. Okay, so I walked close to the hospital where like the first case was seen, right? So people came from that hospital to our side, like when the hospital was closed down. So I guess that like there are 3 times. First time was during O&G, a lady came in, right? She came in at 33 weeks or 34 weeks, and it was like a new booking. So we're all surprised. We're like, Madam, why are you just coming in, right? She's like, my hospital is not, how'd she put it? Well, my hospital is closed down or something, so I cannot go there again. Or is it no, I don't like the hospital anymore. So we now start probing that, Madam, why didn't you like why at this why she now said it's one hospital. I said, what's the name of the hospital? She said, one hospital in Ikoyi. He said, well, like which hospital? Next thing, the woman was like, oh, well, the name of the hospital, the main hospital where the case was actually happening. So like everybody had to like pull back, everybody brought out jig and everything, stay clean around here, because that was the heat of the Ebola when the Ebola was happening. The second time I was on call, where 2 people on call. Then they brought in a woman, she was like unconscious, a lady. So she was bleeding through her, her vagina, her mouth, everywhere was bleeding, and the woman was not talking. So, well, I told nurses that I'm not going to do anything if nobody gives me a history and nobody gives me like any protective gear. I will not do it because this is the heat of Ebola. I will not try it. So people are like, no, she doesn't have Ebola. I said, how do you know she doesn't have Ebola? Do you understand? So I left. My roommates, then she also was on call, so she decided to see the woman and everything. Look at it, like they are suspecting is Ebola, right? Do you know the funny thing is that my problem is that you were suspecting Ebola. They did not quarantine us. Nothing. They let us go home, We went to our families, came back the next morning, for like 3-4 days. Before they found, oh, okay, that she didn't actually have Ebola. That it's just that she has stroke and different things. But my problem was that, like you're suspecting something like this is the heat of Ebola. Why didn't you at least tell us, okay, don't leave this place so and so time. Remain here for now, because I will go home. Okay, what if I'm taking public transport now? I will enter public transport. There are people around me. I don't know if you lived in Lagos, you know how the struggle is in Lagos, right? So there will be lots of people, but nobody cared. So that was it. And I think the final one was Lassa fever. They came in, the man had Lassa fever actually. And they brought him in, man. And they're like, I should take sample. I'm like, I'm not taking, I can't take sample. I don't have any protective gears, right? And they're like, but yeah, doctor. I'm like, we should have protective gears to take how will I put it, sample from that you are suspecting any hemorrhagic fever, right?
Yes.
They did not. At the end of the day, it was the other military man that brought him in that is also like, I think he's a med lab scientist, so he could take the blood and he took the blood and he sent it, and the guy actually had Lassa fever. So I'm like, you'd have put me at risk, right? Without like, it's really unheard of, unfortunate.
Really sad. So, Dr. Dara, what is your opinion on the recent spate of deaths among medical professionals in Nigeria due to all these deadly diseases?
Yes, it's very sad because I feel it's something that is avoidable. It shouldn't be happening, especially now, like we're in the 21st century, right? There are things that should be put in place to make sure things like that are avoided. For example, why will how will I put it, a patient, or why will a doctor want to like see a patient without that you're suspecting, I don't want to say Lassa fever, but you're suspecting something like that, and you are going in with number one, even bare gloves. There are special gloves that are used. Okay, so those you can't just use those simple disposable gloves. It won't protect you from anything. So it's really sad, and to think that now things like that are happening, it's heartbreaking.
Really sad. Okay, I'm saying some medics from Nigeria, Dr. Busi. Please, to everyone in Nigeria watching at right now, we're talking about medic mortality from diseases acquired at work. This is something that affects all of us, whether you're a nurse or a doctor, even if you're a cleaner in the hospital. We're all exposed to all these deadly diseases, and I don't think anyone deserves to die from trying to save someone else. So when we ask the questions, please leave your opinion. We're just having a discussion so we can all try and see what can we do to solve this problem. So recently, I'm talking to Dr. Dara. Recently in Nigeria, the Minister of Health said doctors are to blame for the spread of Lassa fever, that they don't wear their gloves. That once you wear your gloves, what do you think about this? And if you're watching, so please type in your opinion. What do you really think about what the Minister of Health said?
Like, he's my senior colleague, so I really don't want to say what actually, like when I saw it, what I actually said when I actually read it. So I will not say it because, he's my senior colleague and he's actually a minister, so he's one of the top people in the country. But it's very, like, disappointing. Like, I was disappointed when I read that. I'm like, how can you, first of all, forget anything. Those are your colleagues, right? We are medics. So medics does not just mean, oh, doctor, or, medics means like anybody that has to do with the hospital at any point, right? Even the choose, like you said, everybody. Yeah. So when I saw when I saw what he said, right, I needed to be sure that did he actually say something like that, because it is wrong on all levels, right? Number one, you don't come and, even if you feel you are making mistakes, you don't come and bring it out on a national platform. You don't say things like that. That's why we have our bodies, right? We have our different bodies in Nigeria. You should take it there that, oh, this is the issue you guys are having. This is why this thing is happening. That's why it's happening. Let's look for ways to, tackle it. Because later we'll say that people are insulting us doctors, but our top, the person at the top is insulting us already. So why won't people insult us? It happens that every day they are dragging doctors on Twitter on Twitter, and they are wondering why. When our top guy is actually dragging us. That's one. Number two, they trust me, they don't really have all these gears in the hospital. They don't.
I agree.
We work in hospitals that we know that those gears are not there. That's
yes.
I worked in places where you get gloves. Patients buy their gloves.
I worked in the other branch of the place where you worked. I worked in the other branch of the place where you worked during your intern year. And behind us was the Nigerian Institute, where all the patients were being directed to, and we were in constant fear that one of these patients might mistake the address and come to our place. Actually, I was on call one night, and a woman came in. She came in a very funny way because her relatives abandoned her in the emergency department, and she had like petechial hemorrhages all over her body. She was almost unconscious. She couldn't speak. She couldn't communicate with us. And everybody ran away. That's just the truth, because there was no gear. In fact, we didn't even have gloves. I had to buy my own gloves. The gloves we had were being rationed out. I had my own gloves. But I was so scared that, oh my God, what if this woman has this thing? What am I going to do? So I agree with you that we do not have this PPE, but
Do
the
not.
information out there is that we have it and we are not using it.
But the funny thing, trust me, sometimes you'll be shocked. For example, I worked in a place when I was doing my youth service. I will not also name the place, right? We have all these things.
Mm-hmm.
Do you know when the, let's say, the owner of the place was coming, like to see some, check the place? Trust me, I was shocked when they started bringing out different. I was like, it's a lie. We have all these things here. They are locked up. They started bringing out. I was like, excuse me. And when I want this, I have to use my money to get. Do you understand? I'm like, why? Why would we lock it? Who are you locking it up for? When
Mm-hmm.
patients come, all these protective. So as I was saying, those protective gears are not there. I don't know what he's saying. I don't know which hospital he's talking of. Maybe private hospitals, but in most teaching hospitals, those gears are not there. Even if they are there, it's maybe one or two, and you cannot repeat the same gear you use. It's not
Mm-hmm.
possible. There's a way
I
to remove. You have to remove it in a particular order. So imagine you've removed that and you go to put it on it. What happened? So whatever is there, you all take it upon yourself. So I feel that was really wrong what he did. Like those, especially to see that doctors died from it. So he's kind of insulting the memory of those doctors that died from it. It's very, very sad. He could say a thing like that. I'm really disappointed. It was not good.
What do you think we can do to reduce the rate of disease transmission in the hospital, especially from things like Ebola and Lassa fever? Can we do? Because, okay, fine, we've agreed that there is no protective gear, that's the PPE. What else can we do?
Okay, the first thing I feel we should do is that, so I'm going to talk on our part as medics and on the part of the patients and all, or other people that are not medics. The first thing is, as medics, we should have like education, right? They should be able to educate everybody, tell everybody, because the truth is that, yes, you were taught in med school, but it wasn't deep because we were not seeing things like this at that point. So it was just like a surface that, okay, this thing is there, right? So you have to do this, you have to do this. Now it's how like it is. We are seeing it is rampant. We should have, like the way drug companies come to educate us on their medication, the same thing should happen. Hospitals or different bodies, right, can bring up seminars about it. Talk to people about it. This is what you should do. This is how you should protect yourself, right? This is how if you see a case like this is actually what you should do and all. Then on the public, there should be awareness. There is no awareness for these things. Like, I don't think they've even said it, come out, like, talked about it openly, right? Like on our national stage. What we see is on Twitter, on Facebook, on Instagram. Like, you don't actually see it on, like, will I say on a platform. Most times, if CNN does not carry it, we won't even know in Nigeria. That's the truth. It's until CNN actually carries it, then yes, we will know that things like this are happening. So there's supposed to be awareness for it, educate the medics also. Then tell the public too about. They can do like TV ads about it. Oh, this is how it is transmitted. This is how you should. This is what you should do if you suspect this and this and this. Things like that. Tell them if you feel this before you even go to the hospital. Make sure you're hydrated. Don't be dehydrated because that's one of the ways they die faster, right? Even before you get that medication, once you're dehydrated, you have like a very bad prognosis. So that's just it. Education and awareness. I feel that, and also the government should provide the gears. Very important. Provide the gears because I don't advise anybody to do anything if you don't have gears. Seriously.
Okay, I'm going to read a comment from Dr. Eruvu. He said PPE is money. If there is no funding for protection, it will be very difficult to achieve it, no matter how good our seminars and education on the matter is. I agree with Dr. Eruvu, but I also have a question. Recently, we've had situations where the people in charge of the money allocated to the health sector actually gobble up the funds, like they divert it for their own personal gain. So is it a case of we are the cause of our problems? Like those at the top are the cause of some of our problems. What do you think?
Well, yes, that is it, right? Because think about it. When we're doing house jobs, there are some things that should be there, right? Example, gloves,
Yes.
cannula,
Mm-hmm.
those things are available. But do you know that when I was a house nurse, especially when I'm on call, I always make sure in my ward coats I have green, yellow, pink cannula. I have gloves. I'll be running around with it. And think about it. It's not really hygienic me leaving those gloves in my how like the word quote and comma. So you can see things like that. So those are the top. They're not making things easy. If, like, for example, I read the story you talked about, and it's really wrong to think that they gobbled it, and they removed somebody, and the main organ at the top put him back. That's to tell you, what are we saying?
Just one instance, Dr. Dera. That's one instance. There is one that happened in Edo State. So there are like 3 instances I've read in recent times of these top officials gobbling the funds, and those are the people we know. There are some that are still, this,
Yes.
they are intact. Okay, so Dr. Desmond is saying ideally hospitals should have doctors responsible for curbing occupational hazards and control of infectious diseases. You're correct. You're very
Oh, yeah.
correct. Yes, but would you think that we should have a public health department, an active one, not just one with an office, an active one?
We should have public health. We should also have occupational health, because those are different things, right? You should have it in your hospital. And like you said, control. We need all those infectious diseases. We don't have it. It's very sad that, for example, when something like this happens, we are sending everybody to Iruan. Can you imagine? All the way to Iruan, when we have how many hospitals in Nigeria? It's very sad. We need things like this, and the fact that we have people studying all these things, but people just feel that it's not important. Once you're a doctor, you know everything. The sad thing is that we don't know everything. That's the truth. There are things that actually is when you, for example, if I didn't do public health, there are some things I won't have known, right? I had to do. That's why it's a course on its own. People special, everybody. Like I said, we actually need them to be able to give their inputs. Things that I don't know they're supposed to handle it. But did you read the story of that doctor, the other doctor guy, that gave his story?
Of course, I actually I carried that story, and I think that story is it's very shocking.
You know what I'm trying to get? Public health, because actually he informed. If you I read the whole story, he actually informed public health first. If you remember, then who did they send? They sent in someone that could not tell jaundice. So what are you saying? Who are the people in charge? What are they putting? Right? So it's not by having it. We need to have qualified people.
I said the problem from the top, right?
Yeah, from the top, where we put our brothers and sisters to be in charge.
Agree. Now, very important question. So Dr. Desmond, Dr. Erivu, Dr. Busi, if you're still watching, this question is for all of us. Is it right for a medic to refuse to treat a patient who has a highly contagious disease due to lack of personal protective equipment, that's PPE?
Well, yes. I'll say yes, because if something happens to you, right? We're not in a country where you are appreciated. That's the fact. You are not appreciated in our country. So, if something happens to you, what will happen? Nobody cares. For example, we know that Ebola, Lassa fever, things like that, they are highly contagious. Even with your protective gears, there's still some percent. There are still chances that you might get it. So imagine not having any protective gear. What will happen to you? So you finish shooting the person. What happens?
So
what
happens? So
they replace
if the patient comes in, are we going to leave the patient to since we don't have the gear?
Yes.
Well, it's quite unfortunate. Unfortunate that we cannot do anything if there is no gear. That's the truth. Really cannot. But once we fall ill, what will happen to the patient? What will happen?
Yes.
Do you understand? If something happens to you, like, or me, or any medic, while you're doing this, for example, all those doctors that died, trust me, like almost immediately, somebody else was replaced. We have 1,000,001 doctors that are jobless, right? What happens? Once one person dies, the next person takes over. So if those gears, my only issue, if a medic will not work, if the gears are there and you refuse to work, that's where I have an issue. But if there are no gears, seriously, it's up to you. It's your personal perspective. If you want to work, fine. If you don't, seriously. But nobody, I don't even think anybody will fault you for not working if you do not have a gear. And yes, we know that this is what the patient has. Then, I don't advise anybody.
Busi is saying, yes, I would refuse to treat a patient without PPE. Nice. So, Dr. Eru, yes, it's right, very right. You can't strengthen the weak by weakening the strong. Even in flight, they tell patients to put on their oxygen mask before attending to the kid. There's a reason for that. Valid points. Okay. Let me see. Okay, I agree with that. So the next question is, can a medic be considered selfish for refusing to sacrifice their life, like Dr. Adadevo did to save Nigeria?
Okay. So the thing is that, like I said earlier, sometimes we deserve to be selfish, right? See, there are things that you can get back, and there is one thing that you can never get back in this life, and that's life, right? And Dr. Adelebo, like, she paid the ultimate price. She paid it with her life, right? So I feel that in cases like this, of course, why not? But when you think of it, like when I look at that Dr. Adelebo's sacrifice, what she did, it's not from she didn't do that because she's actually a doctor, right? It's the kind of person she is. Firstly, before we are doctors, we are humans, right? We all have our different, how will I put it, the
Personalities.
way we look at life, right? And we have our person, we have the way we look at life and the way we do things. So she might have looked at it, and also she looked at it that, okay, I've already been exposed, right? Do I want to go home and expose other people, or do I feel that, oh, I can as well just continue this and treat myself? If anything, if I'm able to get better, fine. If I'm not able to get better, fine. Do you understand? So it's not being selfish to me, though. It's not being selfish if you decide to, how I put it, think of yourself first as a doctor. Because when we think about it, there are things called hazard allowance. How much do you pay for allowance? They are supposed to, okay, they say that our hazard allowance is 5k, 5,000 naira, right? To risk your life, right? Do they even pay it? Throughout my work in Nigeria, like for how many years before I left, I never saw that 5k in my salary.
But I'm very sure there's someone collecting it.
Of course, but let's not go for that. Do you remember our salaries? What are you saying? Was someone not charging it for the?
Okay. All right, Dr.
What?
Rimu said, if the doctor dies, who will treat the other stubborn patients? Valid point. Okay, Doodlebird said, my suggestion is medics should create public awareness to make the public know the problems they are dealing with without the help of government. Do you agree with that?
Yes, mostly on Twitter and people like you too on Instagram, right? You people are like you're trying to create awareness. It's sad that this is what we've come to, where especially the government they don't want to do it. But my problem is, you are seeing people doing this. Why don't you sponsor them? Do you understand? Sponsor it instead. I don't like talking about like as if no they degrade medics and all, but that's the truth. Instead, they prefer to sponsor other things, right? Other things than sponsoring what will actually affect your health. Because what happens, they don't actually deal with us in Nigeria now. They have cough and they go abroad. They have discharge from the ear and they go abroad. So they really don't care. They don't care about the public. They don't care about the average man, because them and their family, they are good to go. So
Yes, and at this point, I would like to remember when Lagos State was having this. I think when they were honoring heroes, right? There had to be a public outcry before they could include Dr. Adadevo's name in the list. Like
yes,
a lot of noise had to be made. It was like
like
I think she
I was
deserved
like,
something bad.
because that woman alone, do you know what would have happened if she let that guy leave that hospital and they took that to loot, or he traveled to Calabar? Do you know what would have happened? That woman is a national treasure, in short, national hero. They should erect a structure of that woman, because she saved us from a lot of things. Imagine if that man left that hospital, what will happen?
Yes, I
We will
agree.
not have this at all.
I was so terrified that period, very terrified, because Naima was behind my hospital. It was really scary. Now,
Now
Dr.
they closed that hospital and everybody were coming to us. So you can imagine everybody was just coming to us, and I was like, hey God,
Save
my
my.
license is fresh. How will I, it was very sad, that period. It's very, very sad.
Yeah. Dr. Irubu said, at Doodle Bed, we medics, we talk till we lose our voice, but patients don't just listen. Then they expect you to sacrifice your life for their ancestors. Oh, okay. It's true. And Dr. Desmond again, it's a tough one to answer. However, a patient would be within his or her right a doctor would be within his or her rights not to attend to the patient because it may endanger the lives of other patients he attends to, thus making tracing difficult.
Difficult. Yes.
Okay, now our final question, we're rounding up on Medic Talks now. How can we get those in authority to listen to our demands without resorting to strikes? Because with all this, the whole talk about medics dying, we don't have, if we tell the government, they might not listen. So the only weapon we use is strikes. But what else can we do besides the strike action?
So the thing is that we need, for example, we have bodies, right? We should have bodies. We have, well, we know we have the enemy that is supposed to be our, well, I say, body in charge of us, doctors, right? So the thing is that they don't, I won't say, because I won't say that they don't know what they're doing, or because I've never attended any of their meetings, so I really don't think I have the right to blast, put everybody on blast. But there is something called dialogue, right? You should be able to dialogue and stand on your, how will I put it? Stand on what you want, right? That's the thing. For example, like why a lot of doctors go on strike is what happens. They go, right? Maybe those at the head will go and have these dialogues. They're not telling them, we cannot settle all these people, but maybe you people will do this for it, do this for it. This ones will not come back and say, so it's better we, let's give them more time. Let's do this, That's why they can threaten us during this specific time that he stopped residency. He sacked all the residents. How can you do something like that?
Dr. Dara, you've really given this topic a lot of thoughts. Yes, settle those at the top and leave those at the bottom to go about their business.
Yes, so those are the top. That's why you see the way people are fighting. People are fighting to be in charge. Not because they want to actually make a difference. Do you understand? But they want to, well, I won't say take care of their pockets and all, but things like that happen. Because what changes do we see when we do election and that person takes over? What are the changes? It's the same thing we are seeing. For example, doctors are leaving every day. Why? Make some changes. Let's see what happens. Do you think I want to be a tutor? Am I not supposed to? It's very funny, seriously, but
Dr. Desmond has a question. My question is for future sakes. Is there a way Dr. Daredevil could have handled the issue of stopping the Ebola spread then without putting herself in harm's way?
Okay, so the thing is that I feel the first issue we had was that because we know it's Nigeria and he was coming from a particular place, our first instinct goes that, okay, he has malaria, right? So that's the issue we have in Nigeria. First things first, we have malaria. We won't do blood tests, right? We'll start treating for malaria. When it's not now working, we now say, okay, it could be something else. That's when she now decided to. That's when they now thought about it, and she thought, she's like, oh my God, this guy is coming from, this particular place, right? And now his symptoms are not getting better; he's getting worse. Things like this. That's when he now thinking that, how will I put it? This man might be having Ebola, right? So I feel one of the things we should do, first of all, we should not be doing Nigerian, we should do more preventive medicine, right, than actually trying to treat. First things first, if the man comes into the hospital or anybody comes into the hospital, I feel even if you are doing anything, the first things, take blood and check for things like this, right? And if you feel that, because we're not sure, we didn't have it at that point, so we're not yet hotspot, so we didn't actually have our gears and everything, so that was the issue, that was one of the issues we had. So if we already knew that, this thing was happening, was an epidemic or no, I'm sure if she went, before she, how will I put it, saw him, she would have protected herself. So in order to avoid things like, I feel we should not just jump into conclusion when we see patients. We should actually do our due diligence, check, do the necessary things we're supposed to do first, before you now come to conclusion this is what will happen. I know it's quite hard in pressure because when we know first things, our mind always goes to malaria or typhoid, things like that.
But for me, Dr. Desmond, I'm talking to Dr. Desmond now, in my own opinion, because I think when some other Ebola patients showed up in America, they weren't also ready. They were exposed. But I think it's how we manage these cases. Like, fine, this doctor has been exposed. Did we really have a center that was ready to handle such things. They had that in America, even though they didn't know something like that could happen, but it had happened, and they quickly knew the next step to take. Unlike us, it has happened. Then we are thinking, is it Iraq she's going to go to? So I think a lot of confusion when there's a delay in management, it makes the case deteriorate further, which will cause more complications. So I know there's a bill in front of the National Assembly right now for Nigeria to establish CDC and to establish, I think, this CDC, some centers in the 6 geopolitical zones in the country where cases like Lassa fever can be managed. I think this bill is something that should have been passed yesterday. I read it as far as the first and second reading, but it's very sad that as big as we are, we just have one place or two. It's really, really, really bad. And look at, for example, that doctor that wrote his story. If that story should make it to national papers, it's very shameful that he said he was actually traveling unsupervised. Even the person that was sent didn't have gloves. The whole story was messed up.
Think of that Lassa fever. Remember, he said he left, went to his hotel room, and slept.
And he was abandoned. Nobody to care for him. So, like, we have isolation centers. We are really not.
He should put his own line in by himself and give himself the medicine. I'm like, that was just wrong.
Now, from Dr. Eruvu, patients. We need patients to be empathic to our cause. All those medical bodies just talk and talk, then go behind to do their deals. But if patients take part in the issue, okay, Dr. Eruvu is saying patients should help us too. I think the patients could help if they were powerful, but the powerful patients don't even come to Nigerian doctors. Take their outside. So yes, and no matter maybe one day when the youths take over, things will change. Dr. Okay, yeah, please go on.
I feel one of the things is that we need our rightful bodies to fight for us. Take for example what's happening to the girl, that doctor in the UK, right? That Nigerian doctor in the UK that is having that issue. I don't know if you read about it, that her name was removed from the GMC register. Yes. Take for example, do you know that fellow Nigerians, so they have the body of Nigerian doctors and everything. Yes. All it was to write letter. It's letter they wrote to. But look at those that were fighting for her in front of GMC building. The whites. Not the Nigerians too. The white people. A doctor, then some top consultants actually left the GMC. They removed their name from the register. So you can imagine, those people are fighting, right? Medscape, different places are carrying her story. But what is our own people doing? What is our Nigerian government? What are they doing? Our Mansard, I don't even know their name. It was letter they wrote. So that's the thing. If our rightful bodies don't fight for us, we're on our own. And the sad thing is that why is it the young ones that are actually, trying to make things that the old ones don't care? They're like, whatever, I'm good to go. And it's very sad because very soon, I'm not trying to say anything, but very soon, like they say, it's only Dr. Sid that will be left in that country.
The time is coming, but we'll definitely come back to make better. We'll come back to make things better, with Dr. Dara Clinic and all that. Dr. Desmond said it's best to reason the worst first, especially when the patient comes from an endemic region. Nice talk. Keep up the good work. Thank you. Okay, that's Dr. Desmond. Yes, reason the worst, but yeah, I agree with you. Always be ready for something strange at work. We should not be relaxed. I think we're very relaxed. We don't expect bad things to happen. So when a patient comes in with fever, it's like, oh, it's just, as you said, it's just malaria again, but it could be something deadly. So we have to be on guard. But I think with the rate of, if we raise more awareness and people know that it could be you, like now we're having this very important talk, and I think maybe we'll have to do it again because I think more people should participate. I've learned something in life, which is never think it can never be you. So if you're unconscious about an issue, maybe when it comes closer, you realize it's very simple. It's very easy for you to be affected. So maybe we are concerned because it could have been me that night when this woman came unconscious with hemorrhage. I was like, okay, this could be Ebola right now, and I was really scared because they had to take her outside the emergency room and put her. We had an isolation tent actually. It was a canopy outside the ward with not what a stretcher. Oh my god, in the cold. No, oh please, let's not even.
Like
Oh, let's.
I don't even like remembering those days. What we went through. It was not easy. Like we just
Yeah,
thank God that we're, because that 2014, that period was hot. That period,
yeah.
it's not something you can forget in a hurry. I'm serious.
Okay, thank you so much, Dr. Dara, for joining us on Medic Talks today. Uh, maybe when in the nearest future we'll be having this discussion because I would like more people to participate and
Yeah.
get their opinion. We really need to come together as medics if we're going
Mm-hmm.
to solve our health issues, because sometimes when you're waiting for the person ahead of you to talk to fix it, it will never get fixed. So I think together we can actually fix things and make a difference and make our country a place where we'll all be happy to return to and set up our practices. So thank you so much, Dr. Dara, and to everyone that watched today, thank you for your support. We really appreciate your comments and taking your watchers. And remember, till next time, always be brave enough to start a conversation that matters. Take care of yourself. Thank you, Dr. Dara. Goodbye.